All right, we're at the top of the hour, so we're going to go ahead and get started. I'd like to welcome you to the Healthcare Compliance Pros May 2016 Compliance Webinar. Our webinar today is titled Business Associates 101. Relationships with business associates can be confusing, and that's why we are hosting this webinar today, and our presentation will help make sense of your BA and subcontractor relationships. Topics of discussion today will include defining just who your business associates are, training on what 4 factors must be considered after every security incident, including who is required to take reasonable steps to cure a breach or end the violation, and ensuring that you have a HIPAA-compliant relationship with your business associates or subcontractors. So at this time, I'd like to introduce the presenters for today's webinar. I'll be a co-presenter today. My name is Michelle Lyman, and I'm the Operations Manager here at Healthcare Compliance Pros. I serve on the front lines and supporting clients like yourselves with website management and compliance basics, and I'm also involved with product and article development for HCP. And just so you know a little bit about my past life, prior to HCP, I have experience as a medical office manager, a pharmacy technician. I was an EMT at one point, and also a coding manager. Chad Schiffman will also be presenting today. Chad, would you like to just take a moment and introduce yourself?
Yes, certainly. So I am Chad Schiffman. I am a compliance specialist manager here at HCP. I typically consult with clients on their compliance issues, contribute on a regular basis to the insider articles and product development. One of the things that a lot of you probably talked to me about is your security risk analysis. I do a lot of work with those, and my background is actually in healthcare informatics and healthcare administration. So I'm excited to be here today.
Thanks, Chad. At the end of today's presentation, Chad is actually going to host a question and answer session. So if you have questions come up during the webinar, go ahead and post them using the GoToWebinar dashboard so that we can address them during the Q&A segment. So now I'm just going to turn some time over to Chad to introduce today's topic.
All right, well, thanks, Michelle. During this webinar today, we're actually going to be discussing who you should consider to be a business associate. We'll talk a little bit about their roles. We're also going to talk about who's responsible to maintain PHI in a covered entity and business associate relationship. Basically, who's that ultimate responsibility going to fall on? Whose shoulders is that? Who are they going to hold accountable? Those type of things. With that in mind, last month we actually discussed what to do in an event of a breach. So this month, we're actually going to talk about what to do if the breach involves a business associate, how you would handle that breach by a business associate, and we also would like to talk about to make sure that you have a plan in place with some of the tools that we have available to you through HCP. If you notice, we've included a handout with today's presentation. It's our BA decision matrix. With this BA decision matrix, there's also a way for you to actually speak with your business associates to make sure that you actually can get those agreements in place. Oftentimes, that's one of the most challenging steps. So now I think Michelle's going to go ahead and take it from here for a moment.
These are the 4 questions that we need to ask ourselves about whether or not a business associate is actually a BA. So we're just going to review the 4 questions on this slide. So the first is, does the vendor create PHI for your practice? And the examples of this would be transcriptionists, translators, and laboratories. The second question that you would ask yourself in determining whether or not an associate is a business associate is, does that vendor receive PHI from your practice? And examples would be collection agencies, shredding services, and coding auditors. The third question you would ask yourself would be, does the vendor transmit PHI for your practice? Examples would be clearinghouses, billing companies, and statement services. And finally, you might want to ask yourself, does the vendor maintain PHI for your practice? And examples would include cloud services, IT vendors, and offsite storage. So the 4 keywords are create, receive, transmit, and maintain. So we gave instructions on the first slide to open up the handout, but you might want to go ahead and do that by clicking the BA Decision Matrix link on your GoToWebinar dashboard. And this BA Decision Matrix is also saved to your HCP website under Forms. So just a little bit of a tutorial to access your forms on the website. You go to My Offices, click on the Forms tab on the left-hand side of the screen, and it will open up all of the forms that are in the Forms library, and then you can perform a keyword search for the document you're looking for, or you can use the drop-down and just look under the sections, and there's actually a BA section that will open up all of the business associate documents that we have on the website. This document was also shared on your Insider newsletter last week, so you may have already accessed it. It was in an article titled Managing Business Associates to Ensure Low Risk. So now at this point, Chad's going to drill down even further into defining who a business associate is, and that will be on the next slide.
Yeah, thanks, Michelle. So, well, let's talk about it a little bit. So by definition, a business associate is the person or entity that performs certain functions or activities that involve the use or disclosure of PHI, protected health information, on behalf of or provide services to a covered entity. Oftentimes, as you can see on the decision matrix, there are some common vendors that we regularly interact with, whether it's billing services, information technology vendors, your clearinghouses, those type of people, transcriptionists, they're all generally who we'd consider a business associate. Now, one question that we receive on a regular basis is regarding housekeeping and janitorial services. And HIPAA wasn't designed to actually be this big bad wolf for certain things like incidental disclosures, such as might occur with housekeeping and janitorial services. So they'd like to think that unless they are actually handling PHI and shredding them for you and doing things like that, if they bump into it, that is okay. So generally they are not considered business associates. Drug reps, and once again, unless PHI is exchanged for patient services, wouldn't be considered a BA. So those are just some things that we want to make you aware of, because we want you to understand that with regards to the privacy rule and security rule, that as a covered entity, you have to comply with all the requirements. And it's important to note that the BA just must comply with the requirements pertain to their activities that they perform on your behalf. And that is something, even though that they are required to have their policies and procedures in place and be trained and understand your policies and procedures, at the end of the day, they are responsible for what PHI they can actually create, access, store, maintain, those type of things. Finally, it's important to understand that this year there have been some significant breaches involving business associates, and we're actually going to talk about some of those, talk about how the policies and procedures were missing, and in some cases the covered entities and business associates didn't even have a business associate agreement in place. And so it's been a significant year this year with that, and we're going to touch on that a little bit. Now I'll have Michelle take over for a moment and talk about our next slide.
Thanks, Chad. So we're looking at a site that has a poll listed on it, and when polled, 73% of covered entities were not confident that their BAs would handle a security incident or a breach of PI properly. So let's go ahead and read together on the right-hand side of the slide. Let's read about what HIPAA defines a security incident as. So HIPAA defines security incidents as attempted or successful unauthorized access, use, disclosure, modification, or destruction of information or interference with system operations in an information system. And that's all in the CFR. Now let's look at what HIPAA defines breaches as. These are defined as impermissible acquisition, access, use, or disclosure under the HIPAA privacy rule that comprises the security or privacy of the protected information, protected health information, again in the CFR. So after reading these rather technical descriptions or definitions, you might be saying to yourself, I wonder how my BAs are handling breaches or security incidents. Or you may be thinking, I'm so glad that we've made certain that our BAs have HIPAA programs in place, and also that they communicate any incidents and record them properly. Hopefully that's what you're thinking in your head and in your heart, but we just thought maybe you would want to think about that just for a moment. So we're going to actually have you participate in a poll now to get an idea of the level of confidence you have with your BAs. On the national poll, it was 73% of covered entities were not confident. So let's just see what we have going with us. So we're going to go ahead and open the poll, and we'll just give you we'll give you 30 seconds or something to just choose your answer. So let's read it together. Do you know how your BAs are reporting security incidents and breaches? So is it on a paper log at the office, in an electronic format, and they send updates to you? You're not sure, or other? So we'll give you just a little bit of time to choose your answer, and then we'll look at the results. Okay, let's go ahead and look at the results. All right, this is very interesting. So we've got 3% of respondents that say that the BAs are recording those incidents on a paper log at their office. 18% are in an electronic format and they send the updates to you. That's really great that 18% are able to say that. But isn't it interesting that 74% are saying I'm not sure? If we go back to that poll that was taken nationally, I'll just review that with you. 73% of healthcare organizations are either not confident or only somewhat confident that their BAs would handle a security incident properly. And we're seeing that exact percentage almost on our poll today. So you're a testimonial that this is pretty much where it's at with business associate relationships, and we're going to help you figure out how to change that unsurety here in our webinar today. So we'll go
So
back.
with that, as we move to this next slide, more quickly what we'd like to talk about here is some of the root causes that happen with breaches. If you notice on the right-hand side, you'll see that 51% of them are typically with unintentional employee action. 49% are due to a third-party snafu, and we'll actually talk about one here in just a moment. Your criminal attacks, like the cybersecurity crimes we're seeing, those rise up a little bit, and they're at 39% currently. Lost or stolen computing devices, such as from a car being parked and leaving a laptop on the desktop or on the passenger seat, one that we've helped with a couple of times this year. 35%. Technical systems glitch, 27, 10 for malicious insider, and finally 4% for intentional employee action. I'd like to see that number go down as well. All these numbers we'd like to see decrease over the time instead of continually increasing. But just to show you an example of a third-party snafu, there's actually just recently reported that a Washington, D.C.-based Children's National Health System alerted patients to a breach that occurred, and it was due to an error by the transcription service provider. It does look like they did have a BA agreement in place. However, the error did allow patients' data to be indexed by search engines. Healthcare Systems was contracted as a business associate to handle the transcription. They were provided physician notes, but according to the breach report, approximately 4,107 patients' PHI was affected by this. Now, it wasn't just financial information in this case. There was no financial information at all. However, all the PHI was shared, such as there was name, date of birth was also involved with them, some of the diagnoses and things like that. Upon discovery, Children's National Health System had to contact Ascend, who was actually the BA, and demanded that they immediately eliminated those names from the search engine, and ultimately the covered entity, being the Children's National Health Center, was responsible to provide notification to all of these individuals based on the information that was included in their BA agreement. That's something we're going to talk about here in just a moment. Who should be responsible for reporting breaches to these affected individuals? Do you really want that responsibility with the business associate? We're actually going to talk about that here shortly. Now, despite the requirements of HIPAA, not only to a large percentage of covered entities believe they aren't notified of these security incidents or cyber attacks by their business associates, they think it's difficult to manage them for their business associates and impossible to determine the safeguards and security and policies and procedures that VAs need to have in place, or are they adequate for reporting a breach. So it's important to note that, let's talk about timeliness here. The clock starts when the breach is discovered. This is often miscommunicated between business associates and covered entities. Then what we see happen is OCR comes back and goes after the covered entity and say, why are you reporting this breach so late to us? Why didn't we get it in time? Well, it's actually because it starts the second the breach is discovered, and that is by the business associate. So we're going to actually talk about timeliness of notifications here shortly. So Michelle is going to introduce another poll now, and we'll take it from there.
All right, thanks, Chad. So as Chad said, we'd like to have you participate in another poll now. So here's the question. Do you know if your business associates are completing a 4-factor assessment for each security incident? So we're going to go ahead and open up the poll, and here are your choices. Yes, and they are sending us a report of each incident. I think so, but I've not received any incident reports, or not sure what is a 4-factor risk assessment. So we'll go ahead and give you a little bit of time to think that one over and respond, and then we'll look at our results. Okay, we'll give you a couple more seconds to figure out your answers, and then we'll go ahead and post the results. Let's go ahead and take a look and see what we got. All right, so 6% are saying yes, and we are receiving the 4-factor assessment for each security incident. 21% are saying I think so, but I've not received any incident reports, and there we have 73% not sure what's a 4-factor assessment. So interesting answers again. We're right there at that 73%, so it looks like we've got some educating to do. So let's go ahead and look at the next slide and talk about that 4-factor assessment. So here we've got another result from a national poll which says only 58% of associates say that they perform a 4-factor risk assessment. So although we asked you if, what did you think? Do you think they're doing it? This is the poll that's actually the answer. 58% are performing a 4-factor risk assessment nationally following a security incident as required under the Omnibus Final Rule, where 42% of all business associates polled said they were not. So if you aren't sure if your business associates are performing that risk assessment, that might be, you may be in the 42%, and obviously we would encourage you to have a conversation with your business associates. It really is to your advantage to make sure that they are aware of the requirement. And your handout today includes a simple phone script to conduct a BA audit with your business associates. So if you've opened up your handout, this would be on page 2, and you don't need to review it now, but just wanted to make sure that you're aware of it. You can use this when contacting your BAs just to determine what their compliance level is with your contract, and make sure that they're aware of their responsibilities in handling your PHI. So in the event of a breach, you must follow your plan, and your plan must be implemented without delay, just like Chad was just talking to you about, because time really is an important factor in managing a breach and any security incident response. So if an office discovers a breach, they must notify each individual whose PHI was disclosed. Let me say that again. If an office discovers a breach, they must notify each individual whose PHI was disclosed. If a business associate discovers a breach, that BA must notify the practice, and then those individuals must also be identified and notified. So following the discovery of any breach, whether it's a suspected or confirmed breach, you need to evaluate the circumstances, and then if it is determined that it is actually a breach, you'll need to notify each individual whose PHI was, or reasonably was believed to have been accessed, here's those three words again: accessed, acquired, or disclosed. So keep this in mind. Each circumstance where PHI has been inappropriately handled is presumed to be a breach unless the covered entity or the business associate can demonstrate that there is a low probability that the protected health information has been compromised. And there are some exceptions that will allow you to look at the circumstances and then provide notes on how you can how you've demonstrated that there really is a low probability. And this is where that four-factor risk assessment that Chad's going to discuss on the next slide comes into play. So I'm just going to turn it back over to Chad.
Yeah, thanks, Michelle. So the four factors that must be considered after every security incident is, the first one is the nature and extent of PHI involved, including the types of identifiers that were involved and the likelihood of re-identification. Seems a little bit complicated, and it can be. You want to analyze, was it a date of birth disclosed? Was it a name disclosed with the date of birth? Was it just an MRN number with no other identifying information? There's different things that you want to look at and say, oh, if someone got a hold of this, what is this worth to somebody? What is the likelihood of re-identification? The second thing you want to look for is the unauthorized party who used the PHI or to whom the disclosure was made. Now, just recently, an example of this is we had somebody who had an incident that involved PHI being sent to the wrong workers' comp company. So as part of our risk analysis process, we took a look at that. Who was the information sent to and what was sent to them? Then it's whether that information was actually acquired or viewed. Very important to know with this that there are people who may be actually authorized to view the information, and so you want to analyze that. Okay, did it go to somebody like another doctor's office who typically could view this, and what would they actually do with that information? Finally, the fourth is the extent to which the risk of the PHI has been mitigated. Did they take that information? Did they shred it? Did they send it back to you? What happened to that PHI? These are all steps that you want to do as you work through your risk analysis to be determined, because as you can see, 87% of business associates having these multiple security incidents, there is this opportunity for some risk, and we got to figure out who's going to be responsible for doing this. Is it going to fall on the business associate, or are you the covered entity going to research it? And I would say you could have the BA do the research, you could have the BA provide notifications, but at the end of the day, why would you want them to? If ultimately you, the covered entity, is going to be the one that's held responsible by the OCR, it's very important to have some information in place with your BAs to ensure that proper notification, proper mitigation is being handled, and your BA agreement is instrumental in this. We can't emphasize this enough. And now,
Can I add just something,
sure.
Chad? Could I just add something?
Yes.
Thanks. I wanted to just draw our participants' attention to part of their website that will support them in this four-factor risk assessment as well. If you are a current client of Healthcare Compliance Pros, if you go to your Office dashboard and click on the reference guide tab that's on the left-hand side of the screen, it will open up, we call it like a three-ring binder of all compliance information, but if you go into the HIPAA security reference guide, you can do a keyword search on risk analysis, and it will give you some more information about how to perform risk analysis and how to manage that. You might want to, the keyword search you might want to perform is risk analysis and risk management, and that will take you to the section you're looking for. So I just wanted to throw that in there.
Well, thanks for sharing that. And you know, it's also, we also talked about it a little bit in our reference guide, and you'll also see some articles about it within our Compliance Insider. So there are different ways that we try to communicate this information to make sure everybody goes into it with, you know, how OCR looks at it. You should have known, not that, oh, oops, I didn't know. So I try to provide as much information as possible. So on our next slide, we're going to go ahead and do our final poll, and we just want to know if you have updated BA agreements with your business associates. So if you take a few seconds and provide an answer to that, we'll take a look at the responses and see what we got. All right, so I think that's been long enough. We'll go ahead and take a look and see how many said yes, how many said no, and how many said I don't know. So as we wait for these results to pop up. Okay, so 50% of you say that you do have updated, 27% say no, and 23% of you say you don't know. So also included in the form section is an updated current BA agreement that meets the HIPAA privacy rule and HIPAA omnibus requirements. You're more than welcome to download that. If you have any questions about your business associate agreements, we'd highly recommend you contact us so that we can help you with that. So now we're going to go ahead and move on to the next slide. Let's go ahead and take a look at if a vendor is a business associate, why it's so important, and why it is extremely vital to have a BA agreement in place. Failure to execute a BA agreement with vendors carry hefty penalties. As we're reaching down here to the bottom, 2 recent settlements underscore the importance of executing these BA agreements. The first settlement involved, you may have seen this in the news, North Memorial Healthcare of Minnesota, who had to agree to pay $1,550,000 to settle charges that it potentially violated HIPAA by failing to implement a business associate agreement with a major contractor and failing to institute an organization-wide risk assessment to address the risks and vulnerabilities to PHI. The other settlement we'd like to talk about was Raleigh Orthopedic Clinic of North Carolina. Their penalties and corrective action plan were not quite as significant, but fairly close. It was $750,000, which is quite a bit, to settle for approximately 17,300 patients. And this was interesting because with this one, it was a potential business partner that was provided the information, but there wasn't a BA agreement in place first. So this was kind of interesting with this one in that they had just barely received the information and then had to go, oh, whoops, we didn't have a BA agreement in place. So that's something that you want to really make sure that you have in place, because otherwise you'll be like them, paying fines, you'll be working on a corrective action plan, you'll be revising your policies and procedures that we do have in place for you with the HIPAA privacy course, HIPAA security course, they are there. So you want to make sure that you have those in place. Finally, once again, I want to just talk about timeliness one more time. The clock starts when a breach is discovered. You want to have that BA agreement in place. You want to have that language covered. That is very crucial to include in your BA agreement. For example, we have in ours that is the template that you can use and modify that it should be reported to the covered entity upon discovery without reasonable delay within at least 30 days or less from discovery. So that is included in there. If you need, once again, the updated BA agreement or would like us to review yours, please contact us. I'm going to turn the time over to Michelle to talk about some of these tools that we have in place.
So each of our clients will have access to a variety of forms that will help you manage your business associates, and I've included just little screenshots of each of the forms here on this slide. So if we start with the business associate decision matrix, which is about 11 o'clock on your slide, that is the handout for today's webinar. To the right of that is a spreadsheet, and this is a BA audit spreadsheet. So if you are conducting an audit of your business associates using the script that you'll find on the business associate decision matrix, you might want to use the BA audit spreadsheet just to document your findings, and that will help you put together a plan as to what you need to do next with that business associate, whether it's putting together a new business associate agreement or if it's just confirming that you have everything in place. So the third and final and fourth item that are shown on this screen are the business associate agreement and a cover letter. Both of these are also on the website and available for you. And again, all of these forms and documents that you'll find from your office dashboard on the HCP website are you can edit them. So if you open up this cover letter for the business associates, if you are reaching out to them for an updated business associate agreement, for example, you can take what we've got on this letter and use parts of it that you like, or remove parts, edit it, put it on your letterhead. Just make it your own. We provide this information as a sample and a support for you, but don't feel like you have to use it word for word. So if you do decide to contact your business associates using the phone script on the second page of that decision matrix, I just wanted to go over a couple of the questions that you might ask them just to give you an idea of what this script would include. So you might ask a compliance officer of one of your business associate organizations, have you updated your HIPAA policies and procedures, and when did that happen? You might ask their compliance officer, have your staff been trained on these policies, and when was the last training? Things that you know about your program already, you know when your staff has been trained and you know when the last training was. You might also ask them things that are a little bit trickier, like what access controls do you have in place to protect your PHI, the covered entities PHI, and we give you some ideas of what answers that you would be looking for. So again, those answers to the questions would allow you to either check them off as a HIPAA compliant BA with an updated agreement, or maybe it's time to implement a revised BA agreement that complies with that omnibus rule language. Or if you're looking at your business associate agreements and you found that your old agreements were signed prior to 2013, or if it doesn't include the updated language, then you'll want to obviously use an updated form that you'll find on our website. And then the final thing that you might be actually documenting on that audit spreadsheet is that the results of your conversation might be not that great. You might be documenting that their responses were that they were non-compliant. And at that point, you would need to determine whether you can continue using your services. So let's go ahead and move on to the next slide. I'm going to review some additional BA support we provide in what we call our Corporate Plus program. So the Corporate Plus program is part of we have a variety of plus services, including HIPAA Plus, OSHA Plus, Corporate Plus, and HR Plus. But today, because we are discussing business associates, that is part of our Corporate Plus program. And I just wanted to share with you some of the information that you'd be able to track on our website. So part of the service is business associate and vendor tracking. And what it allows you to do is take those business associate agreements or confidentiality agreements that you have from your vendors, upload them onto the website, and then once you've added those BAs and their agreements, we will immediately begin to check these companies against the OIG's LEIE and notify you if they appear on the exclusion list through a report that we email you each month. So let me just give you an idea of what the OIG's LEIE is. So if you participate in any Medicare, Medicaid, Medicare Advantage plan, you are required by law to screen all of your employees, your vendors, your business associates, and their subcontractors against the Office of Inspector General's, that's where we get the OIG, Office of Inspector General's list of excluded individuals and entities. That's the LEIE, so the list of excluded individuals and entities. And you're required to do the screening prior to hiring or contracting with them, and then you're required to continue to recheck the LEIE every month thereafter. So you can choose to have us perform the service for you, and most of the people that I work with actually choose to use the service just because it takes a great weight off of your shoulders. It's kind of a pain to have to check this every month, and we're happy to do it for you. If that's something that you'd like us to help you with, we'd be happy to work with you. So at that point, you just sit back and receive a report every month that highlights any matches, and then the website will give you instructions as to your next steps if there are matches. Obviously, you can reach out to your representative at HCP also to help you if you do have a match. So I guess my suggestion would be talk to your rep if you need training on using either the basic program to support your business associates, or if you need extra help on managing the corporate compliance services that you already have, or if you feel like you need the corporate compliance services so that we can track your business associates, so you can load them on the website and and make sure that you've got all of those business associate agreements archived in a safe and one spot, we'd be happy to help you with that as well. So this concludes the training segment of the webinar, and I see that we have several questions that we'll be answering in our Q&A segment, and I'll just turn that over to Chad. He'll help us with that portion.
All right, so I'm taking a look at a couple of the questions that came through, and as Michelle said, we'll go ahead and do the Q&A session now. If you have any additional questions following these, go ahead and feel free to type them in. Be happy to answer any questions you might have. The first question that we had come through, let's bring this one up here. It says, when submitting a business associate agreement to a vendor you didn't previously have a BAA with, is it a best practice to date it when you begin doing business with the vendor, or is the current date okay? So with that, what's important to know is your business associate agreement should have an effective date in place, and you want to have it when you can do it a couple of ways. You could go ahead and backdate it, but we just recommend doing that from the date you've actually signed that agreement going forward, and just document that this is when you've agreed to doing that services. And then you'll also want to include on there your expiration date, and usually that's when you're no longer contracting them to participate as a business associate and handle your creating, maintaining, or whatever they're doing for you with the PHI. So that's when you would want your effective date on there, and for the length of it, it doesn't need to actually include a specific date. Like, you don't need to say, I'm going to end at 1/1 of 2017. You can just do at end of when services are no longer being provided to the covered entity. Another question we have come in is, let me take a look at this one. If a business associate reports a breach, who is responsible to provide notification to affected patients? Now this one, it boils down to really the language on what you have in your business associate agreement. But as we've mentioned before, ultimately the OCR is going to hold you, the covered entity, responsible. So we would recommend, in our opinion, just to make sure that they're provided properly, that the covered entity provides those notifications. Same thing with providing notice to OCR. Once again, the OCR is going to go ahead and hold you, the covered entity, responsible to make sure that they receive the timely notification. You could have the VA do it. Once again, it does boil down to the language you have in your agreement, but it still is the best practice. We think the covered entity is the best person served to do them. So this time we'd like to go ahead and conclude our webinar. There are a couple of ways you can get a hold of us. Here's our contact information. Michelle's email address is included here. Mine's included here as well. We also have our phone numbers and extensions listed. So if you have any questions, you can reach out to us that way. But we definitely like to thank you for joining us for today's webinar. It will be recorded and included in next week's Insider. And Michelle.
Okay, let's see what else we can say. I think the final thing that I'd like to say to you is that we do have a survey that we've posted for you to participate in at the conclusion of our webinar today. So if you will please consider filling out the survey, it'll just give us feedback on this webinar and maybe future training topics that you'd like to hear about. And then as a final reminder, the 30-minute compliance trainings, just like this one today, are held the second Thursday of every month at 1 p.m. Eastern. So just put that on your calendar so that you'll be able to plan in advance. And Chad and I would just like to say thanks again, and we'll plan on meeting you here next month.